Hi, my name is Mark Wade. Today what I would like to talk about is a little bit of a modern era historical perspective on trauma. And our understanding of trauma has led to our modern understandings of, say, post-traumatic stress. And then following that, I'll just kind of briefly discuss trauma wisdom. I would like to give thanks to the Niwa family. I feel a deep connection to this series. Brandon's sister, Lindsay, is a nurse, and Brandon's wife, Ashley, is also a nurse. I'm a nurse as well. I've worked in 5 different provinces and probably 20 different emergency departments throughout Canada, so I've experienced a lot in my life as well. My fiancée, Suyen Lam, had passed away approximately 8 years ago due to a drunk driver, a trip to Thailand. And as such, I myself created a scholarship legacy for her at our alumni university. To start at the beginning, trauma obviously is a condition that has been known since the beginning of time. Trauma has taken on different terminology, different meanings. There's different types of trauma. At the basic, there's type 1, which is acute onset of a traumatic experience. Could be referred to like a car accident. We have type 2 trauma, which is more of a prolonged episodic trauma. It could involve complicated surgery, it could involve experiences in wartime for veterans. And then we have type 3, which is called complex trauma. And complex trauma can originate in childhood from abuse or neglect or a difficult family home. And complex trauma can also happen in the adult lifespan as well. There's essentially 3 origins of trauma: human to human intentional, human to human unintentional, and then natural causes. The human lived experience across race, religion, and culture is often very similar. It's what we refer to as the 4 F's of trauma: fight, flight, freeze, and fawn. The fight response is pretty known to most. That's when we aggressively respond to a traumatic incident. A person, it could create an anger response in an individual. The flight response is quite literally when people will try to flee a traumatic incident. And then we also have fawn. Fawning is a very particular response to a traumatic event. Fawning is often seen maybe in the context of a difficult family situation, or maybe in a human context or a relationship situation where the person sort of becomes hyper agreeable to sort of avoid a traumatic response. And then we also have the freeze response. We'll often see that in a traumatic incident. You often see that in a car accident where a person quite literally, they freeze and they don't know what to do. In the 1970s, as individuals were coming back from the Vietnam War, it was known that they were presenting with very specific trauma soliloquy. Basically, like symptomology is essentially what soliloquy of trauma refers to. That's around the time that the medical community coined the term post-traumatic stress. From post-traumatic stress, the medical community developed a medical model basically that we refer to as trauma-informed care. It looks at an individual more from a perspective of what have you gone through, what have you experienced, and how has that had an impact on you, as opposed to what is wrong with you. So we kind of shift that paradigm to a more empathetic, compassionate lens. It's a different paradigm of enabling a person to share their story. It's sort of providing a map where no map exists. It's allowing people to understand your reactions, your response to an abnormal event, they're normal. Doesn't mean that there's something wrong with the individual who's having that experience. If we can provide that to the youth, if we can provide that across institution, organizations, within associations, we're empowering one another to accept our lived experience and to not avoid that experience, but instead find a way to embody that lived experience, to empower ourselves so that ultimately we can view other people through a more compassionate and empathetic lens. As we moved into trauma-informed care, between 1995 and 1997, the CDC and the Kaiser Permanente, which is a profit and a non-profit organization in California, they had conducted a very large-scale study for childhood adverse events, or the ACE study. Approximately about 18 to 20,000 participants were in that study. And what that study looked at was the effects of adverse events on children. The ACE study looked at 10 different particular factors. With each adverse childhood event, these numbers just started to multiply. For example, a child noted to have, say, 4 or more adverse childhood events, the risk of suicide as an adult went up by over 1,200%. The risk of smoking, or the chance of them developing a smoking habit later in life, went up approximately 360%. Risks of obesity and diabetes went up over 300%. The ACE study really started to focus on, let's take this further and let's look into a childhood perspective and see how does that look? What's the impact of adverse childhood events, and how does that then manifest into a pathological soliloquy as that child enters adulthood? The children are the seeds of tomorrow. When we're in leadership roles and leadership positions, it's invaluable that we can even refer to our own lived experience and share that as a concept of wisdom, especially today. So if we look at today, life is irony. From adverse experiences, we also have an opportunity to create tremendous growth. We can share those experiences to empower other people. Understanding the soliloquy of a traumatic event helps us to know how to provide the care, or to provide, the education, the empathy, the compassion, and the validation to that individual's experience, because we have an understanding of what the outcome is going to be, or how that individual is going to present following that event, which enables us to provide care and comfort to an individual. Knowing the human lived experience enables us to help support and ultimately to heal others. When we look at the Brandon Niwa legacy, it's important to note that his sister Lindsay specifically mentioned that she was interested in the proactive piece of mental health as opposed to the reactive piece. To go back to the trauma-informed care piece and post-traumatic stress from the Vietnam era, when these individuals were coming back from that war, that was still technically reactive because you're dealing with these individuals after the fact. It's still a reactive level of care. What we need to provide to individuals who've experienced an event, who have gone through something, traumatic or something truly difficult, we have to sort of normalize the process. We have to provide education so that people can understand what is happening to them. We might feel that we're having an abnormal reaction, but we're not. It's a normal reaction to an abnormal event. Often I've had people reach out to me and say, I've gone through this experience and I feel like I'm going crazy. And I say to them, you're not going crazy. You're experiencing a very normal reaction to a very abnormal event. What you need around this piece is education. You need to understand how your body is reacting. You need to understand what your emotions are trying to communicate to you. We need support. We need to provide empathy and compassion to individuals, and we need to validate an individual's experience so that they understand that we're listening to them, that what they're experiencing is real. We can touch on those 5 points when we provide support and education and empathy and compassion, and we provide validation. Ultimately, what we're doing with a person's experience is that we're enabling that individual to begin the healing process. Once we help that person to find that sense of empowerment, that's what we refer to as post-traumatic growth or post-traumatic resiliency or trauma wisdom. And these individuals have a tendency then often to become quite impassioned by their own experiences, and often will share their own experiences with other people. And ultimately, that's how we support one another. That's truly the definition of compassion. When we come together to listen to each other, to provide comfort, to provide an ear, or to truly listen to one another. And in doing so, we support each other as a society, as a whole. People often ask me, how do you heal from trauma? And I say, well, to heal from trauma, there's certain elements, or there's certain steps that we need to tend to. We need to provide education. We need to provide support. We need to provide empathy and compassion. Ultimately, the goal is to empower that individual to reach that totality of lived experience, to embody the empathy and compassion, to embody that insight gained from that experience, and then ultimately to be able to share that experience to help others. Part of how we do that is we have to learn how to teach people about what we refer to as emotional intelligence. Emotional intelligence, this is not a new concept, but emotional intelligence basically refers to the ability to understand how our emotions communicate to ourselves. Through the COVID world, what we're kind of seeing is sort of what I would say is a sort of a more vested community approach or a more invested societal approach to mental health. A positive outcome to COVID and this current pandemic situation is that a lot of individuals are sort of getting a first-hand approach and understanding to what trauma feels like for many individuals who have experienced a traumatic situation. The feelings of uncertainty, the feelings of insecurity, instability, not knowing what tomorrow is going to bring. When is there going to be a return to normal? For a lot of people who have experienced trauma, this is often how they experience daily life until they learn how to incorporate that totality of their lived experience. Bringing that to light, if you look further down the road, I think a positive aspect that will come out of this situation is that community as a whole, our society will inevitably come together and be able to share a lived experience and support one another. The underpinnings of emotional regulation is to understand or to know our emotions and how they speak to us. Why do our emotions speak to us? We often learn the basics of emotions. We all know angry and we all know sad. We know happy. There's a context behind emotional regulation that is also very valid and important to recognize, and how that is important to managing our daily adult life. As an example, a lot of times people struggle with emotions such as, say, depression or anxiety. But anxiety, really what anxiety truly is, it's our emotions communicating to us to tell us that there's a problem. If you use an example of studying for an exam. So if we're nervous about an exam, we've identified that as anxiety. That's just our body's way of telling us, prepare, we need to study. It's identifying there's a problem, and then the anxiety kind of lets us know that we need to find a solution. And depression can be sort of the same thing. Depression, it's a normal emotion. It's an emotion that we need to learn to embrace and that we need to be able to learn how to be with. The emotional regulation is just that. It's learning how to be with our emotions. It's learning how to identify our emotions and how to sit with them and sit through them and listen to them and allow ourselves to understand what we are trying to communicate to ourselves. And this falls back into all concepts of mental health. If we aren't able to understand what we are communicating to ourselves, it's going to be really difficult for us to communicate to other people what it is we need. Some of the basics, when we go back to the proactive concepts of mental health, is beginning with emotional regulation and teaching people at an early age, or teaching our children how to communicate with themselves and how to not avoid difficult conversations, how to not avoid difficult emotions, and how to learn how to sit with them and listen to them, how to cope with them. When we learn those skills as a child, that inevitably provides us or positively enables us with greater coping strategies as we move into adult life. 8 years ago, when my own fiancée passed away in Thailand, that was a traumatic event. My reaction, I felt at the time, to me, it was an abnormal reaction. But in hindsight, I recognize that as a very normal reaction to an abnormal event. That moment went on to obviously completely change my life. Commonality between trauma survivors is that the traumatic event sort of creates this divide. And how time becomes measured often changes in and of itself. In normal day-to-day life, or what we call normal, I'll refer to as normal day-to-day life, individuals, we make plans. We see time as a reflection of maybe accumulation, or we see time as celebration. What are our plans for Christmas? How are we going to celebrate our birthdays? But often a similarity in the world of trauma is that an individual who survives a traumatic event, they often sort of split that time. There's like the life before the traumatic event, and then there's life after the traumatic event. And when you find yourself off the proverbial rails, often what that means is that you're having a hard time sort of incorporating these two events. So you have this life trajectory that was planned before, and then now you don't. If you look at that concept of a life trajectory, it's sort of like thinking about it, like using an analogy of a train on a track. It has a certain momentum. And if you take that train off the track, it doesn't just stop. It's going to keep going. So at one side in your mind, you're thinking, okay, I have all these plans. And then all of a sudden, there's this other reality that sort of is running parallel that says, that's not going to happen anymore. Once you lose that sense of purpose, that sense of hope, it quite literally derails your life. So even for myself, after the traumatic event, time sort of took on a different concept. So then it became, how do I cope with Christmas? How do I cope with a birthday? Do I have enough support? What does it mean to have enough support? How do I seek enough support? How do I develop the coping mechanisms necessary to not feel emotionally overwhelmed by these anniversary dates. For myself, when I went through this event, it was a challenging time because I felt lost. I didn't have a concept of a map. I didn't know where I was going. I didn't really know what I was feeling. My sense of self-emotional regulation was not where it is today. Through that lived experience, that really propelled me to do a lot of self-reflection, a lot of work. Over the past 8 years, I've traveled quite extensively. I've traveled to numerous countries, and I've done a sort of a deep dive into how do other cultures and how do other religions, how do other faiths, how do they cope with trauma? How do they deal with the human lived experience that so many of us deal with? And that provided a really eye-opening experience. A traumatic event often has this very powerful way of taking away a person's sense of hope, of a person's sense of purpose, because you're on this certain life trajectory and then you're not. It changes. A very powerful traumatic event sort of derails you as such. Ultimately, what that leads to is this concept, what we call today, of post-traumatic growth. Another term for post-traumatic growth is what we call post-traumatic resiliency. We also refer to that as trauma wisdom. What we mean by that is that we're trying to steer away from the concept of looking at a person like, what is wrong with you? And we're trying to acknowledge that lived experience creates wisdom. When we talk about post-traumatic growth, we're talking about once we provide an individual with education and support, empathy, compassion, and validation, ultimately what we're looking to achieve is to empower that individual. What do I refer to when I say empowerment? I'm referring to an individual's ability to embody and incorporate their lived experience, to take an abnormal situation and normalize it to the best of their own abilities, emotionally and mentally, ultimately, providing compassion, empathy, support, education, and validation. What we're trying to do is we're trying to empower another individual's lived experience. We're trying to make that lived experience a safe space. We're trying to allow that individual to step forward and say, I've experienced this, or I've gone through this, or I've lived through this, and not feel under the shadow of that situation, but to find the best way possible to embody that experience, to utilize that lived experience, to find within the self a deeper sense of compassion and empathy that before the event they wouldn't necessarily develop. And that becomes a skill. For an individual to reach that level of emotional insight, it changes. To truly move through a traumatic event, there is no over, under, or around. There's only through. We have to find that sense of acceptance in ourselves. We have to embody that sense of totality. A lot of people, when they experience a traumatic event, often the first response is, how do you cope with this? What are these emotions? What are these feelings? What do I do with this? A lot of times, traumatic events cause an outcome. People feel lost. They don't know what to do. Trauma doesn't come with a map. In a physical healthcare setting, if someone presents in an ER department and breaks their arm, you know the process. And through society, we already know that process because we've had friends who've gone through it. So, you'll go into Emerge, you'll have an x-ray, maybe you'll get a cast, you'll go home, your friends will sign it. It's almost an event that's sort of pseudo-celebrated in society. And then you'll have the cast removed after X amount of weeks, and we know the outcome. When it comes to mental and emotional health, we haven't really reached that point yet. We haven't reached that point where we normalize the situation. People still feel quite lost. We don't provide that sense of direction in these situations. But the truth is, there is a direction. A traumatic event does not take away from an individual. It actually provides an individual with a new lens. Once an individual has moved through a traumatic situation and reached that level of post-traumatic growth or resiliency, it actually empowers that person to see other people through an empathetic and compassionate lens. The empowerment of another individual through their own traumatic experience is an ironic gift. It's the ability to see other people then through a compassionate and an empathetic lens that otherwise you wouldn't have. And that's what it means to heal through that, is that you've incorporated that into self, you've accepted that into the self, and now you're able to use that experience to help other people. We're empowering individuals at a young age to understand emotional regulation, to understand emotional intelligence, to learn how to speak to themselves, so that in life, if they experience adverse events, they have a better understanding how to communicate with the self. You live a story and you learn how to share your story. That's truly what it means to be human. To live your life, own your life, and then share your story, share your experience, and use your experience through that lens of resiliency to help empower other people to reach their full potential, so they in turn can then support and help other people. When we talk about proactive healthcare, and we talk about proactive mental and emotional health, that's truly what we mean. We're empowering other people to reach their full potential even through adverse events, so that they can then share their story and empower other people.